And welcome to Great Day Houston. All right, you got them through the school year with late night discoveries that a project was due the next morning, midnight emails asking what your child is bringing from the bake sale you didn't know about, and of course carpool, homework, extracurricular activities, and day-to-day life. Kids might think the summer break is for them, but guess what, mama, it's for you too. Or maybe you've just been all about the job and everyone else. Take a minute to treat yourself. Look in the mirror. What improvements would you like to make? For many women, that improvement is a breast augmentation to be better proportioned, look better in clothes, and to boost confidence when gravity makes its move. Joining us with one of the latest techniques, Gala Flex, to keep things perky, our double board certified plastic surgeon, Dr. Paul Fortes, and his patient, Jordana. Good morning.
Good morning, Deborah.
How are you? I'm good. When I went through that whole list of things to do, Jordana, you were just nodding your head. In fact, your kids just got out of school?
They just last week.
Yeah, okay.
So my first week of freedom.
Yeah, of not making lunches and not doing all that type of stuff. All right.
They're on their own.
You look fantastic. We're going to talk to you in just a second. But Dr. Fortes, I mentioned that you were double board certified. I want to get that out of the way first. Because somebody has doctor with their name, they are allowed to technically do some things, but they might not know technically how to do those things.
Right. Well, board certification is important because if you go online, and it's available to anybody who cares to look it up, there's an organization called the American Board of Medical Specialties that lists all of the real boards. And by real boards, I mean they're a rigorous examination of doctors who go through a program to study their field of specialty. And they go through a very extensive process of a written examination followed by a oral examination. So it's really rigorous, it's really tough. It kind of weeds out the doctors that are not able to do it. And so this is not a weekend course in Cancun where they mail you a gift certificate at the end of it.
Yeah.
So, but you know, people have to do their homework.
Yeah, and on top of that, you have the years of hands-on experience as well. A little bit about your background. At a very young age, you just always loved art and science, and what better place to put that than plastic surgery?
Well, you know, I say to patients that it was kind of a winding...
look at your young picture.
Oh, yeah. Those are my parents. And, you know, my dad was in medical school in Cuba in the late 50s and early 60s, and his dream was to be a doctor. And bad timing for him, the Cuban Revolution hit. He had to decide whether to stay in Cuba, join the Communist Party, and become a doctor, or get the heck out of Dodge. And he decided the bigger picture, let's get the family out, let's go to the land of opportunity, the United States, and that's why we're here. Yeah,
and that's why you were able to carry on that dream. Your surgery approach is it's never cookie cutter, and that's when you have the real artist involved.
Well, I feel that's true for anybody that comes to see me. I don't impose my idea on them. I have to bring the best out from them and what they bring and what they would like as a result.
Well, you brought the best out in Jordana over here. Okay, Jordana, you were always kind of that athletic girl, and, and when you're athletic, being flat-chested kind of is an advantage.
It was until the sports stopped and the children came. And so
children do their number on the body. So at what point did you look in the mirror and say, okay, this is what I'd like to change?
It was pretty much when everyone around me just knew that I was flat-chested. And I knew that I wanted to change. I was 20 years old, and that's when I reached out, did my research, and made sure that I went with somebody who knew what they were doing. Dr. Fortes, his, credentials were up there, and so I had a consult with him at 20 years old, and he gave me my first breast augmentation at
and
20.
Made you feel comfortable, because when you walk in and you're like you're bearing your breast, right? It's like, but that's first we should know that this is what you do, right? So this is, it should be an easy conversation, and you explain what you want. And so we are looking at some pictures right now to see just the difference that it made, and then how it made you feel, Jordana.
It was day and night. Day and night, the confidence levels that you receive when your clothes start fitting the right way, when you just have a different step in your walk. It's everything. The smile on your face, the way you carry yourself, it's everything.
All right, and then you went back in.
I went back in because they always say, you should have gone bigger.
We're in Texas, right?
Everything's bigger in Texas.
Well, I didn't go bigger, but I went perkier. But anyway, so speaking of perkier, okay, so looking at there's a transition here. And so obviously the first time she was like, let me get the fullness that I want. And then there's the lift there, so explain the process here.
Well, the first picture was age 20. She came to me for the very first time wanting fuller breast. She had a 20-year-old's body, tight breasts, but small, and she wanted a little bit bigger, so we did an implant that was more conservative, natural looking, you know, kind of for an athletic woman. And a year later, she came back and decided, I want a little fuller, so we went fuller. And then I didn't see her for a while.
I had those, so that second set of breast implants that I received, I did carry those for 12 years. I did birth 2 children with those implants, and I did go through breastfeeding with both of those.
So your breast will change over time. So,
Oh yeah, it's inevitable.
Yeah, so there's something else that you have now. The cool thing is that technology changes, right? And
Every
so you have this thing right here, a GalaFlex. Explain what this is and how that can make a difference.
Well, I brought some things for show and tell. Here's an implant, a silicone implant, just to kind of show the audience what an implant looks like. And this is a mesh that we put internally. You know, I liken it to an internal bra. You don't see it. An incision is made that can be made very small. And this is placed inside. It's stitched in. The implant sits above it, and like a little hammock, it holds the implant. So it's gravity defying, or as close to it as we can.
And you don't see any of it.
You don't see any of it at all. And so the weight of the implant is transferred onto the mesh, which is stronger than the tissues of the breast. So it stays up for a longer period of time, and the results are much longer lasting.
I want to address a couple of myths about breast augmentation, because you're the kind of person that when you're at the cocktail party and people find out what you do, you were stuck in the corner by the punch bowl and they're asking you these questions. One is, oh, but if I get breast implants, I can't get a mammogram, can I?
No, that's a myth. That's not true. Women with implants can and do get breast implants. I mean, do get mammograms.
Yeah, and I do that.
It's the same machine that is used for women that don't have implants. The only difference is that they have a different set of views that they use so they can examine the breast tissue more thoroughly.
Yeah, all right. The other myth is you can't breastfeed, and your Donna's like, no.
Oh, no. You can breastfeed totally normal.
Yeah. And then the other question is about the safety and silicone versus saline.
Well, you know, this kind of goes back to the early 90s when the implants were pulled off the market, and they were pulled off simply because the studies hadn't been done. So in the past 30 years, extensive studies have been done, and it's probably the medical device that has received the most intensive scrutiny and examination than any other device ever. And so it's been found to be safe. It's not associated with diseases like lupus or rheumatoid arthritis or cancer of the breast. But that doesn't mean that there aren't risks associated with the surgery, because there are. And so what I do is I have a conversation with the patients and explain to them what the risks are. And the risks, by the way, are fairly low. And they are informed and make a decision whether to proceed or not to with surgery.
All right. As a plastic surgeon, you couldn't just focus on one thing. you focus on a lot of things, and just, you know, you and your entire group are the best experts at all of it. Facelifts, you know, somebody can come in, whether it's a full facelift, a partial, whatever, you can address all of that. Eyes, sometimes it's just the eyes that need to be addressed when people have hooded eyes. Nose jobs, all that type of stuff as well.
Well, that's what makes the field so fascinating and keeps my interest and keeps me fresh, because there's so much variation and variability that I have to stay on my toes and everything, and stay current with all the procedures that I do.
And of course the mommy makeover. So you took care of the top half. And a lot of women say, okay, now give me that flat stomach. You do the tummy tucks as well, that make a big difference as well. And by the way, men as well, because what happens is they start seeing mama looking good, and they're like, well, now I can't be left behind. So men will come in and get procedures too. I want to wrap up with, you also have a med spa. So sometimes you just need things to kind of, like, whether it's your fillers and things like that, to kind of fill in the gaps in between.
Well, the beauty in that is that, you know, my expertise is in plastic surgery, aesthetic plastic surgery. And my employees in the spa do things like fillers and Botox and laser treatments, so they complement each other. And so patients will have surgery and they're fine. They won't have surgery for a while, but they can do the maintenance in the spa.
Yeah. All right, Dr. Fortes, I have a challenge for you. I want you to pop on Great Day Houston every now and then. If you see me going south, I want you show up with a scalpel, you show up with an OR nurse and everything else, and just get it done. All right.
Done.
You're Donna. Thank you very much for sharing with us this morning. If you're ready to transform your body and get the confidence you've been looking for, Dr. Fortes is offering a special promotion. Right now, get a breast augmentation for $5,999 or $141 per month when you finance with Patient Fi. Book your consultation today by calling this number. It's 346-258-7776. Again, that's 346-258-7776, or visit fortesmd.com.